Hey guys, please watch my video till end because the quality content which I will provide you in or less than 3 minutes will be priceless and very useful to you. It might change your life, so I don't think you will skip my video. So let's start the powerful video. Tea is a beverage that in general is seen to be beneficial to one's health. Yet, there are specific health issues for which some people should limit or completely avoid drinking tea. It is essential to keep in mind that people react differently to the same foods and drinks, which is why it is always recommended to speak with a qualified medical professional in order to receive individualized recommendations. Before starting the video, please do not forget to like, share, subscribe, and press the bell icon for new interesting videos. The following is a list of medical issues for which persons may need to take caution when it comes to the use of tea. 1. Conditions relating to insomnia or sleep disorders. Caffeine, a stimulant that's included in tea, has been shown to prevent people from getting a good night's rest. Caffeinated tea should be used in moderation if you struggle to fall asleep or suffer from insomnia, especially in the afternoon or evening. This is especially important to remember if you drink tea in the morning. 2. Gastroesophageal reflux disease, GERD, or acid reflux. The caffeine and other components in tea have the ability to relax the lower esophageal sphincter, which could result in an increase in the severity of acid reflux symptoms. If you suffer from gastroesophageal reflux disease, GERD, it is recommended that you select low-acid tea kinds and drink them in moderation. 3. Conditions related to anxiety or panic attacks. It is well known that caffeine has the ability to activate the central nervous system, and consuming an excessive amount of it can make symptoms of anxiety and panic disorders worse. If you are sensitive to caffeine or have a tendency to experience anxiety, you may want to consider switching to a herbal tea that does not include caffeine. 4. Problems associated with iron absorption. Tannins are found in tea, and they are chemicals that have the ability to bind to iron, hence reducing the absorption of iron. It is best to avoid drinking tea with meals if you have iron deficiency anemia or other challenges with iron absorption. This is especially important to keep in mind if you are eating iron-rich foods or taking iron supplements around the same time. 5. Kidney stones. Some varieties of tea, such as black tea, include oxalates, which are known to play a role in the development of kidney stones in persons who are predisposed to developing them. If you have a history of kidney stones, your healthcare practitioner may advise you to cut back on oxalate-rich foods and beverages, such as some types of tea, in order to prevent further kidney damage. 6. Individuals who are pregnant are typically given the advice to limit the amount of caffeine that they consume while they are pregnant. Consuming an excessive amount of coffee while pregnant has been linked to an increased risk of miscarriage as well as a lower birth weight for the baby. In order to identify an appropriate amount of caffeine consumption for a pregnant woman, it is strongly advised that one seek the advice of a qualified medical practitioner. 7. Concerns regarding bone health. A number of studies have found that drinking an excessive amount of tea, particularly in the form of strong brewed tea, may hinder the body's ability to absorb calcium, which in turn may have an effect on bone health. It is recommended that you consult with your healthcare physician regarding the intake of tea if you're concerned about the health of your bones. Keep in mind that moderation is essential and that everyone's reactions to tea are different. It is best to seek the advice of a healthcare professional if you have specific health problems or conditions. A healthcare professional will be able to provide personalized advice based on your medical history and needs. Like, share, subscribe, and comment.